Hi, my name's Steve from Action Kidney Cancer, and today I'm delighted to be joined by Michelle Greenwood, who is the Macmillan Lead CNS Clinical Nurse Specialist at the Imperial College Healthcare Trust. Today, Michelle's joining us to talk about what is an MDT. An MDT is something most of you will have probably heard of at some point during your kidney cancer journey. So I'm really thankful for Michelle sharing some time today to help us understand what an MDT is. So thanks for joining us, Michelle.
Thank you for having me.
So, first question really is, in this sort of industry, we hear a lot of abbreviated terms. What is an MDT? What does it stand for?
So MDT stands for multidisciplinary team meeting. That basically just means that there are people in that meeting who come from all disciplines in healthcare. So you'll generally have a pathologist, a radiologist, you'll have the medical oncology team, probably clinical oncology team, your nursing team, so your specialist nurses. So it's basically about getting all of that expertise together in one place, and they will look at all of the images that exist. They've had scans and things like that. They'll look at those pictures in detail. The radiologist will go through them in detail with the wider team, pointing out any areas of abnormality or areas of disease there that they can see. And then the pathologist, if you've had the biopsy or anything like that, will look at the tissue, or will have already have looked at the tissue, and they'll discuss what they found. And then all of those things will be discussed with the different team members, and they will offer their areas of expertise and opinion on what is being shown.
So, multidisciplinary team is the people that are involved or could be involved in your care sitting around a table to come up with the best possible outcome for you as a patient for your particular scenario.
Yes, so you will get some people have sort of slightly different areas of expertise. So some people, their area of expertise would be like radiotherapy, for example. Then you'll have other people who are surgeons. So the surgeons will be there as well generally. And they'll talk about what's the best treatment plan for you as a patient according to what they've seen under the microscope, what they've seen on the images. And everybody will have probably slightly different variations of what they think. And so it's about coming together to discuss everybody's different opinions and finding the best solution for that patient.
Perfect, because we see a lot in the kidney cancer community of people are quite scared of what an MDT means. So if we're told by our consultants, surgeons, CNS that our case is going to be discussed at MDT, that frightens people sometimes. What could
Yeah.
you tell us to reassure them?
So I think that it is a scary process, because it feels like people are making decisions about you and your care that you've never met or never spoken to. I think the best way of thinking about it is kind of the way that you said, is that these people are all kind of trying to find the best solution. It is really important that you have discussed with your own consultant and your specialist nurse. Your specialist nurse is really your voice at the meeting. If they know what it is that you want to happen to you, if you have any particular preferences, say for example you're kind of dead set against surgery, they can voice that for you at the MDT, so that those people who are discussing your options can take that into consideration at the time. And that saves delays where, someone might come back to you and say, oh, the MDT thinks that you should have surgery, and you've always said, I don't want any surgery, I'm not having surgery. If they know about that and they can voice that for you at the meeting, then they are your voice. Your CNS is key in that, and also your own consultant as well. They will be looking at what they feel, based on evidence, based on practice, based on papers and things that have been published, what is the best course of action for what they see according to your imaging and your tissue.
So within that, I heard you talk about getting your voice across at an MDT. Can a patients or carers go to an MDT?
I think because of the process of the MDT, how detailed it is, and the fact that they talk about many, many different cases, one after the other, it's not possible for patients to go to an MDT. And I think that's why it's really key to have a very good relationship with your specialist nurse. And if you don't have a specialist nurse, then you should ask why not. Because everybody has the right to have a specialist nurse, someone who is an expert in their area of disease, but also has that close working relationship with the rest of the MDT. Because your CNSs will talk to the surgeons, they'll talk to the oncologists, they'll talk to everybody involved. They are the person who will kind of hold it all together for you, and everybody has the right to have a specialist nurse. So knowing that your specialist nurse is there representing you hopefully kind of takes away the anxiety of not being able to be there yourself to represent yourself, because your specialist nurse will be doing that for you.
Is there anything else that you can think of that might be important for a patient or a carer to know about an MDT?
It shouldn't be seen as a scary thing. It's trying to standardize options for people and making sure that, we've covered all options. Because if you were just to see the medical oncologist, for example, in a clinic, they may think that you should take one course of action. That doesn't necessarily mean that that's the only course of action that's available to you, but it may be the only course of action that they've kind of explained to you. So when you've got the MDT, you've got other opinions too. So it should be seen as a way of like making sure that all options are explored. Can I have surgery? And that's something that you can ask your oncologist. And then the oncologist, if they're not sure whether this is a feasible surgery, for example, they can say to you, well, I'm not sure, I don't think so, but I can ask the MDT, and the case can be discussed at MDT. So it kind of widens the care options in a way. And it may be that everybody agrees that, for example, surgery is not an option. So therefore we wouldn't do that. And that kind of gives you that reassurance that it's not just one person saying that. You have actually had all options covered, I think is a good way of seeing the MDT.
Well, thanks very much, Michelle. I've really enjoyed learning more about an MDT. We really appreciate your time.
Thank you for having me.